On this episode of Plastic Surgery Uncensored, we're going to talk about what happens when the unexpected happens. When in mid-surgery, your plastic surgeon discovers something he didn't think was going to be in there. It's going to be a very interesting episode. Please tune in. Thank you for tuning in to this episode of Plastic Surgery Uncensored. It's going to be incredibly interesting. We have not one, but two guests, and the subject matter is when in mid-surgery, your doctor finds something incredibly unexpected. So Dr. Raban's going to take it away from here. Dr. Raban being the board-certified Beverly Hills plastic surgeon who actually found the things in the two patients.
Thank you, Monique. Thanks for the intro. So what we're talking about today, which is an uncommon but certainly important topic, is when you do surgery, every once in a while you discover what you weren't expecting. So surgery has a lot of the unknown. And so what we have today is we have two wonderful guests, two of my favorite patients. Actually, ironically, both of them had recently undergone abdominal surgery. And during both of their surgeries, in the midst of surgeries, I sort of found things that I didn't expect. So everyone's wondering what those things are. These were abdominal masses. So then the question then becomes is like, oh, crap, what do we do when we find this, and what's the recovery from such a thing? Can
you define for me, the layperson, what exactly is an abdominal? Is it like a chunk of fat? Is it the alien?
Sure.
Like what was in there?
So in these particular instances, and so this is why we have them as examples, is well, let's introduce our first guest.
Okay.
Because who's on the phone with us. So what happened was with Therese, what happened was she came in for garden variety abdominoplasty. How many children do you have, honey?
I have two. One is 10 and the other one is 3.5.
So is that a tummy tuck?
Yeah. So she's a beautiful mom in great shape. She came in for an abdominoplasty or a tummy tuck. We were doing her surgery, and during her surgery, as I'm going along my routine, as I have the abdominal wall, meaning the skin and the fat elevated, and I'm looking at the muscles which were separated, I noticed that there was a pretty sizable fullness or firmness to her abdomen, which is abnormal. Like in a young woman at her age, that shouldn't be there. And so, of course, I was a little concerned for her. We finished her surgery. I wake her up, and I tell her, I said, hey, listen, Therese, you have this, just FYI, everything went great. Surgery was wonderful, but unfortunately, I noticed this very sizable mass. I'm concerned because I don't know what this mass is. It's intra-abdominal. It means I can't see it. I can just feel it, and I can tell that it's pretty sizable, and we need to now work this up. What could it be? I don't know. It could be anything. It could be from something that's benign to something that's cancerous, but it certainly needs attention. So that's the moment where we then decide, okay, well, what happens at this point? And who's your advocate, and how do you get it done? So, Therese, tell us what happened after that, and sort of your journey after I told you in recovery that this was going on, and what happened then?
Okay, so I knew I had a little bit of recovery to do. Obviously, right after surgery is not the time to get up and go see your doctor right away. So I had to be patient and wait, which was hard. I had recovered for about 2 weeks, 2.5. And I made an appointment with my regular OBGYN doctor, and she did a vaginal ultrasound to check to see if she could see what you had found. And she said, oh my God, there's something on your ovary. It's huge. It's like literally just like a big mass. And I can't even see the beginning and end of it. So I need to send you to a hospital to do a more thorough ultrasound. So I went for a second ultrasound, and sure enough, it's a 6-inch wide mass, and they have no idea what it is. So I underwent a multiple of testing, blood tests, CT scans, and all the rest of it. And of course, my OBGYN was saying, this is going to need to come out. We need to biopsy this thing. And my first thought, selfishly, is, oh my God, my perfect scar, my perfect tummy tuck. I just underwent.
I mean, she's literally 2 weeks out from undergoing a massive abdominoplasty.
Just so you know, the other patient's laughing. So evidently there's some identification there.
So can I ask you a question before you go on?
Sure.
Which is, did you have any clue this mass was in your abdomen? So this is the first step, which is...
Yeah, absolutely no idea.
So the first question is, do you know, do you not know? Did you know were you getting bloated? Did you look like you were gaining weight? Tell us.
Did it hurt?
Yeah,
Like
there,
sometimes
there
if you
was
get a
little
bloat,
bit
it
of,
hurts.
yeah, bloating can hurt in itself. So I honestly thought,
Right.
I'm aging, I'm just bloated, I ate something, it's uncomfortable. My periods were getting heavy to the point where they were sort of almost uncontrollable. But I thought, well, this is natural. I'm changing. I'm getting older. It's hormones. I had no clue that this had something to do with the growth that was inside me.
Okay, so nothing in advance gave you any clues, which will be in dark contrast with our next guest and our next patient who talks. But so then they sent you and they said, okay, there's a huge mass on ultrasound. Tell us more about what the discovery was like.
Yeah, so they did a blood test to see if they could tell whether or not this was cancerous. It came back that it was a low risk, but not a no risk. So we didn't know for sure. And my OBGYN, she's pretty insensitive to things like this. So I decided, this is a very sensitive matter to me because I just underwent surgery. She didn't seem too concerned about the whole thing having to be done again. So I was lucky that I had you to advocate for me. And you were the one that told me, hey, you should really try and find an OBGYN that really cares.
Okay, so stop right there.
Yeah.
So that's really right there. You just basically nailed it on the head. The issue is not that you had the mass, because shit happens. The issue is when you realize you had the mass, and at that moment you needed the help of your medical community, your doctors and people to help you through this challenging time. What's challenging? You have a massive mass. You don't know what it is. You don't know if it's cancerous. You just had a tummy tuck. You need people to care. Your experience was, which is going to be echoed by our next patient, which is going to be echoed by thousands of Americans, is that when you went to your doctor and said, whoa, you felt that she was in general insensitive. That's what you said. And you didn't feel like she was way alarmed or seemed to really get the level of complexity and anxiety that was there. And so you actually had
Absolutely not.
Right. So then you actually had to come back to me as your plastic surgeon. In theory, in theory, it's like, this is way out of my wheelhouse, right? I mean, I'm your plastic surgeon. Your result looks great. This is your OB's responsibility. But because you're my patient and I'm a doctor, it doesn't matter if I'm a psychiatrist, a pediatrician, or an OBGYN or a plastic surgeon, we take care of you from A to Z. Now, I may not know exactly what to do, but I sure as hell know doctors, and I sure as hell know that I can follow you through the journey, even if you're not that's not my area of expertise. So you and I spoke, and what did we discuss? You said, my OB doesn't seem too concerned, and what did I say to you?
Well, you said that it's really important just generally in life to have a doctor that cares, and that your opinion was that I needed to change my doctor. You needed to potentially, we were talking about whether or not we could actually have you come if we had to do surgery. Would you be able to join in on that surgery? And do we have a doctor who's open and willing to discuss such a thing? And there are options out there. This doctor immediately had told me, my OBGYN, that she wanted to cut me open again.
Right, from stem to stern, right?
Right. And you told me there are options. And I didn't know, as a patient, you think, well, maybe this is the only way. But you were the one that told me there's no way. There's other options.
So I think that's the second really important thing that I really want to, I'm going to use you guys to really, if you're unhappy with your doctor, and you're in Wyoming and California, get another one. We know so often you feel like you have no other choice. Like, well, oh crap, well, this is it. And because I was on your team and together you had me in your corner, I said to you, well, no, that's ridiculous. Like, she works for you. Like, fire her.
I have a question. When she was your OB prior to the mass, like, did she, with your children and whatnot, did she display this insensitivity prior?
Yes, she did. But I was already pregnant at the time, and I didn't want to change my doctor because, you're familiar with the person. And I knew she had terrible bedside manners, but I sort of I dealt with it. And, I thought, well, in the future, maybe I'll get a pap smear. But it's not, I never thought something like this would ever happen. And now I figured, now I really need somebody who is actually going to care.
Great.
Okay.
So that's what I'm trying to echo. So purpose of today's dialogue is to tell patients that they have advocacy and that if they're unhappy with the care they're getting, if they're not comfortable, they don't feel their doctor's fighting for them, then get another one. We live in
Absolutely.
America. We live in the United States. Even if you're in a small little town, go to another. I mean, just find someone until you find someone that gives a shit.
When I asked the question, I actually thought I was going to have an opportunity to show like how smart I was, because I expected her to say, "Oh no, when she was just my OB and we were having children, she was lovely." But then when I came with this mass, and then I was going to say, "Well, maybe there's some unconscious aggression because she feels that this was a cosmetic surgery and a trifling, and her opinion of you changed." But guess what? That wasn't even the case.
No,
I thought I was going to be really smart, and I wasn't.
I can tell you.
She was a bitch before, and she was a bitch after.
Bitchier after. She looked at me as if I was just a superficial woman who went ahead. She goes, "Well, this wasn't very smart of you. You should have. You shouldn't have had this tummy tuck." That's what she told me.
So there you are. So instead of helping you in a moment of crisis, she makes you feel bad, which happens often in cosmetic patients because there's a certain guilt associated with it.
Yep.
And doctors that are sort of more like if you had your breast done and all of a sudden you had a breast cancer, which have zero to do with each other, as if to say, well, then you deserve it. What does that mean?
Well, that's the point I wanted to make, was that I plastic surgery in itself is you're right, no different than a haircut. No one makes you feel bad because you cut your toenails or get a haircut. It's beyond, it's above grooming, yes. But I do think that there's an unconscious aggression against women who take steps to be their best selves, to do something and fix something.
And empowering themselves.
100%.
So you came to me. You said, this lady's no good. We found you a new physician. And then you said exactly the right thing. There are options. And until you hear those options, you can't be in despair. Yes, the original option you were given is, you had a tummy tuck, whatever. We need to cut you from the top of your rib cage down to your belly button, open it up and whatever. And after having spoken to more intelligent, more educated, more experienced physicians, OBs, what did we ultimately end up doing with you? What did we find?
So we scheduled an appointment to have my surgery done at Cedars, where you also have privileges. And so thankfully, you guys kind of organized a date that would work for everybody. So you were there, and then my OB doctor was there, and other specialists came along. And we basically used my old scar from the tummy tuck, and you gave me a new scar that is in complete seam with my old scar. And actually, now that I look at my stomach, it looks absolutely immaculate. You could never tell that I'd had double surgery in this area. And actually, it looks incredibly perfect. And I'm ecstatic about the results. But like you said, if I would have left it to my old doctor, I probably would have had a scar going from basically the top of my ribs all the way down my stomach.
And what did we find? What was the ultimate? What was this mass?
This mass was benign. They couldn't even tell whether or not it was a cyst or a fibroid or what it was, but it was just a ginormous. Basically, when you look at it, it almost looks like an organ. It looks like a heart, where it's a solid mass.
So it was a ginormous retroperitoneal mass that measured. What was it? What was the dimensions that they told you when they took it out?
6 inches wide. And it was solid.
6
so it was
inches
heavy.
wide of solid. So it was the size of an eggplant.
Yeah.
That she was carrying. How tall are you?
I'm 5'2".
How much do you weigh?
I weigh maybe 125.
So 5'2", 125, and she's carrying it's the size of a brick in her belly. It took a very skilled specialist, because we were at Cedars. I was there. I participated because I care about her. So much it's cosmetic surgery. So now that they found this mass, you know what, screw it. Let's just cut her open. No, because she's going to be a mom. She's going to be a wife afterwards. And we can't just ignore all of those things because, there's this thing in there. We're going to work our way. And we struggled because it made it more challenging. But everybody was on board because we have a group of physicians that cared. We had to bring in a specialist because it was so complicated and so large. But everyone was committed to helping her out so that she would A, get the tumor out, and B, still be whole and sound and feel beautiful. So now she's a win-win. She removed the mass and she still looks gorgeous. She didn't have to give one up for the other. And it all came from the fact that you continue to find and search for physicians that are actually your advocate, not antagonistic towards you.
Did you see the mass when it came out, Dr. Raban?
I'm telling you, it was like a child. It was a massive, and to be honest with you, at the beginning we didn't know if it was benign. I mean, it was after pathology because it was so big. And
You must feel so good having that out. If I had an eggplant in there.
I do, and I think it was part of the problem why I never really felt like after a C-section, and even with diastasis as a problem, I always felt like bloated, and I couldn't figure it out. And now, obviously, I realized that it had something to do with that as well. The way I looked.
It's not just gas.
No, I was literally pregnant with this mass.
Yeah.
Wow.
Well, I can't even express to you how much, that this brought us even closer together. And I'm so happy for you. You're such a
Thank you.
wonderful, wonderful person. And, you deserve to be happy, and you deserve to look good. And, now you have a great new OB that you connected with. And,
I can tell you this. I can tell you this. Today, I'm going to a pool party with celebrities, and I would normally say no, I don't want to go because I would feel uncomfortable. But right as I'm talking to you guys, we're actually packing our bags and taking my kids to one of my clients who's a big time celebrity, and I'm going to feel comfortable for the first time in my life in a bikini around other adults, where I normally would cover up with, a big towel or a dress or, not go in the pool. But today is like my first time ever that I can actually go to a party with my husband and feel like I belong there, I can be comfortable, and I don't have to worry about what I look like.
In a bikini.
We're so happy for you.
Thank you.
You deserve it. And you know what? Thank you for coming on and sharing your story.
Oh, I'm happy to.
And have a great time and enjoy your party.
Congratulations.
Thank you.
So when we come back, you're welcome, honey. So when we come back, we're going to speak to yet another patient. I'm not kidding. These are separate patients, have nothing to do with each other, separated by a few months, in which we found yet another unknown mass. And we'll give you some more information, so stay tuned.
Please stay tuned to Plastic Surgery Uncensored. When we come back, our second guest, where we found the unexpected. Welcome back to this episode of Plastic Surgery Uncensored. In this episode, which is extremely interesting, we're talking about what happens when the surgery is underway and your doctor finds the unexpected. Dr. Levon?
First of all, so happy to see you.
It's
you look
good
wonderful.
to see you. You're my favorite doctor.
Well, you're one of my favorite patients, and we're so happy that you're here because you're going to give us a second perspective of this sort of, while I'd say it's uncommon, it's not that uncommon, obviously, because you're here and we just spoke to Therese and she had a similar such situation. Yours is going to be slightly different in that you're still in the midst of it. And you're going to express yet another frustration. And the topic today is not just, oh my God, what happens when you find something during surgery that you don't expect? It's just a dovetail into patients who feel frustrated that they don't feel that the doctors that they've selected are their best advocates. And what do you do? And we want to push the message that you change doctors. I mean, there's this feeling in philosophy that you're sort of stuck. Like, I've picked this doctor and this doctor knows me, and then you're not in a marriage. You hired them. And when they show signs that they're not doing their job, you need to fire them and move on till you find a doctor that is going to do what you need them to do. So let's dive straight in. Tell me, how far out are you from surgery?
6 weeks?
6 weeks.
6 weeks, yeah. And I feel great.
What did you have done?
I had the diastasis recti repair, triple hernia repair,
What?
and body lift.
Triple hernia
Repair, yeah.
So you wouldn't expect that because if you can see her, she's tiny, petite, she's beautiful, and she's really very well put together. But you had children?
I had 3 children.
3 kids.
And 2 of them were C-sections back to back. I got pregnant like 4 months after I had my middle child, which was a C-section. And then I got pregnant right away. And then I had another C-section because it was too close together of C-sections to even let me have a natural delivery. And then after that, it was like, I just felt off. Something didn't feel right. I can't even really explain what it was. It's just something felt really off. And I started losing the baby weight really, really quickly without trying. And while that sounds great and everything, it's a concern, right? When your whole life, you have to work at it if you want to be within the weight you want to be. At least a little bit, at least got to exercise and eat healthy. And that wasn't the case. And
How much weight did you lose in what time frame?
I'm under my pre-pregnancy weight by about 10 pounds.
Wow.
So what happened was when we met, she came to me and we met as a sort of a standard patient who had had several children, and she was unhappy with her appearance despite what she just described, which is she was obviously...
Well, it's mostly the diastasis recti, which is why I saw him, because I did my research and I knew that he specializes in fixing moms, and I kept throwing out my back, and I thought, okay, well, maybe that's what's going on, because I'd been seeing doctors for months and I had done CTs, MRIs, all these scans, and they were really dismissive. And, well, you seem fine, your blood works fine, this is this. And I was diagnosed with millions of different things, polycythemia, a blood disorder, and they ruled that out a year after. What else? Anorexia. They told me I was anorexic. So, like, that's not me at all. You know, it's like they I don't know. They just couldn't figure out what it was. And because they didn't see it on the scans, it didn't exist.
So let me give you a little bit of a timeline. So we met, and at the time she had what would be expected. You've had 3 children. She's in reasonable shape. She had definitely a diastasis rectus. For those of you who haven't listened to the other podcast, that's muscle separation, which is incredibly common in any woman who has had children, no less 3. That separation of the muscle creates a bulge. That bulge creates weakness. That weakness in the abdomen leads to back pain and all kinds of sorts of issues. In addition, because she had lost a lot of weight and she had gained weight during her pregnancy, she had a lot of loose skin. Furthermore, she had some hernias along her abdomen. So what we ultimately decided to do was do a circumferential body lift, which seems aggressive for how small she is, but she had lost a lot of weight and she had loose skin all the way around. We repaired her entire diastasis and fixed her hernias along her abdominal wall. And when I saw her in pre-op, she had this sort of premonition. I said, literally, I was marking her, and I said, "Everything, you ready?" She's like, "Yeah, I'm ready. I'm a little nervous." I said, "Well, what are you nervous about?" She's like, I swear to you," she said, "I'm nervous you're going to find cancer inside of me." I swear to God, that's what she said to me. And I
believe you.
I literally looked at her and I said, "What are you? How
well, I had you feel it." I said, "But feel this ball. It's gotten worse." And you said, "Well, we'll figure it out when we get in there." And I knew he was going to figure it out. But it's kind of bonkers that I had to go find a surgeon, a plastic surgeon, and electively have a surgery just so somebody would open me up. Because honestly, if I'm telling you the truth, that's kind of what it was about for me. I just needed somebody to open me up and figure it out. I had all these issues that needed repairing anyway. So it was like...
So what she had told me is that she had this area that was bothersome, which seemed and behaved and acted like a standard hernia. She had other hernias being areas where you have a little bulge in your abdominal wall. She's a young girl, no reason to think otherwise. She had had a previous CAT scan, which is the gold standard of checking inside your abdomen. So she had brought in addition to the things that we talked about, she had brought the area of concern in her abdomen up to the attention of her OB and her general doctors and everything. They had done a so-called $1 million workup, and everything had come back as negative, and they were very dismissive. So when I saw her and she said that, I said, "Don't worry, we'll figure it out." So I'm in the middle of surgery. I'm doing a surgery, and I open everything up. And similar to the last patient, I feel through the abdominal wall. I can't see her organs, but I can feel it. I'm like, whoa, what the hell is this? And there is a very, very firm, rock solid mass that I can feel right through her abdomen. And she's very thin, to the point that I was very concerned. So, of course, at that point, we're in the middle of surgery. I can't see it. I can't biopsy it, but I damn well know sure there's something not right. I finish the surgery, do everything. And then in follow-up, I said, "Hey, listen, you know what you were concerned about?" I said, "There is definitely a mass." She's like, "I told you." I told you, meaning like, so I've been telling everyone. I said, "Let's go back and do some investigative research. Let me go see your CAT scan. Let me look and see if they missed something in hindsight." And so the issue that she's been running into, and while we're having the dialogue, is, "So tell me what's gone on." So I came out of surgery, told her there's something there, and I said, "We need to figure this out
And that
ASAP.
was 6 weeks ago.
Correct. So tell me what's happened.
What's happened since then? Unlike the other patient, I didn't recover for 2 weeks before going to doctor's appointments. I think it was like right after my post-op appointment with you, I started going to the doctors, and I had another scan, and they didn't find anything. And I went and saw an OB, and she said there was nothing there. I had a vaginal ultrasound. There's nothing there. Basically, I went around to 5 other different doctors, and there's nothing there. And the last doctor I went to was another OB who suggested putting me on Lupron hormone injections. And that was her solution to the whole problem. And
Let me ask you, so the last patient was complaining about this. This is the key. Feeling dismissed. And feeling like, in your instance, people are going, "Well, this is not my area. You need to see Dr. Smith." Dr. Mrs. Smith says, it's not my area. You need to see Dr. J. And so what you've been expressing to me until we kind of eventually have changed gears is the frustration that no one is taking you seriously. You feel dismissed. And the irony is that I have gotten on the phone with your doctors, have I not?
Yeah, definitely, which is, you know, not even his job, not even his area. And how is it that my plastic surgeon is the one who is advocating for me more than my general, than, you know, all of these specialty doctors?
And how long have you had your general?
For at least 2 years. At least 2 years. And she's great. I like her. But I mean, she just...
Nobody had a sense of urgency that somebody said, hey, look, she was wide open. It's not even
Do you know what it is and I've told you this, is I feel like doctors don't like it when any sort of patient tells them what, like I told them what I think the problem is. I've had hernias as a kid. I had 5 hernias as a kid. So I think I have a hernia. I think I know what it feels like. I think I might have hernias going on. And they tell me, no, you don't. I don't feel anything.
So obviously the patient went in and said, I had these issues. And they did a workup. I don't want to say they dismissed her, but the workup found nothing. So at that point, that's it. We're done. But she's still complaining. So I get on the phone and I talk to her doctors because I want to advocate on her behalf. And I feel like if I get on the phone and talk, they're going to be like, of course. I'm like, I got on the phone. I said, listen, whatever CAT scan you guys have done, whatever you're finding, I'm telling you, I, with my own 2 fingers, palpate a substantial mass, which is not normal. So we need to continue finding ways to figure out what it is, and we cannot stop until we figure out what it is. So 6 weeks goes by, and what we discussed, which we talked about with Therese, is now we need to find new doctors. Why? Because her previous set of doctors have no sense of urgency, continuously pass the responsibility to other people, and at the end of the day, so what we've done now is I've shifted gears, and like with Therese, I'm now introducing her to excellent doctors, because they exist, that are now going to take her seriously and do the things that are necessary, which is like an exploration and go look in her abdomen with a scope and a camera and see what it is that they're not seeing on a scan that could be seen visibly. Maybe do a colonoscopy, etc. So what we're trying to echo and reiterate is that if you're at a place in your life and you're with a doctor and you know that something's not right and that doctor isn't taking you seriously, then what you need to do is go find another doctor. You're not without options. It's not the end of the line. You live in America.
No, true that. But interestingly enough, I feel like you have instincts about your own care. And right now, where you stand, you're 6 weeks in.
And we still haven't figured this out. But he's referred me to a doctor who's his friend. And that's probably what's going to happen this next week, is setting that whole thing up. Yeah, because it needs to be dealt with, especially since all the swelling's gone down. I mean, I can see it now. You know, I mean, it's still
it's
in
there.
there.
It's not didn't go away.
No, it didn't go away. So now that my, everything else is all tight and everything, it does stick out. It's not going to go away. So I have to figure it out. But I think following your instincts is something that's huge. I mean, I told you, I was like, there's something here, and I think you're going to find it. And when he told me he found it, I was happy that somebody could identify
You're not crazy.
that I'm not crazy. Yeah. And I would tell the doctors that. I'm like, you know what, this makes me feel crazy, is a doctor opens me up, says that he sees something. I know there's something. And then you tell me, nope, there's not something on the scan. So I don't know what to tell you. It's like, I mean, what's your job? Isn't it your job to care for me?
You would think.
Well, and I've heard a lot of times doctors will tell me, well, 9 times out of 10, it's nothing.
And
Yeah, but what about the 1?
Yeah.
What about the 1 in 10?
Exactly.
Wow. How are you feeling now about going into the surgery?
About going into another one?
Yes.
Oh, well, I don't know. I guess I'll get there. We'll see when I get there. I mean, hopefully if they have to go back in, Dr. Raban can...
We're going to address whatever we need to address, but the most important thing is that we find out what this is so that we can address it as it needs to be addressed and put this issue behind us. Beautiful. And so when she feels that she has been finally understood or heard and there's a diagnosis, it puts you at a greater ease. Whatever that diagnosis may be, it's better to know than not to know. And that's really important.
It was a waste of my time, 1.5 years, going to all these different doctors. And
Now, Teresa mentioned depression. Were you feeling depressed when you were getting kind of batted around?
I think most people probably would. I'm a pretty resilient person, and I don't know, I just emotionally can handle things like this, and see like what needs to get done, not just sitting in it. So I think for me, not so much. I was relieved when he told me, that it existed, because I was close to giving up and even finding an answer and just saying, you know what, I guess this ball, we call it my ball is just what it is, and it's just going to stay there. And so when he found it, I was really grateful.
So you're happy. You're like, I'm not an inherently lumpy chick. This does not belong here.
Yeah.
Well, and he made me look really good. And to tell you the truth, having your ab muscles together is really important when you have kids. And for that reason alone, I think this is the best decision I ever made. Just having my body feel together. I look amazing. Yes,
there's
I do.
two components to this.
You do, actually.
I do look amazing.
So
yes.
there's two components to this. The reason we brought you here today was obviously not to highlight or discuss the body lift, which in of itself is worthy of a discussion, and the transformation and how amazing you look and how great you feel. Today's discussion is about patients knowing that they have options, patients knowing that if they're not connecting to their physicians or feel dismissed or not received, there are alternatives. And those alternatives are that you just find other physicians, because in this country, there are many, many outstanding physicians who will advocate for you. And if it's not their area of expertise, AKA me and masses, then we will help you find the people whose expertise it is. So this idea where, my doctor, people come to me all the time, and then when I do their workup, I find out that they're diabetic, right? So I could be like, you're a diabetic, talk to me later, and when you're ready and you're better, call me back. But I don't. You're a diabetic. Let me help you. Do you have a doctor? Not really. Okay, well, I know some amazing physicians. Let me give you some guidance and let me help you to your next destination. That's our job. That's our job as a collective whole, even if it isn't our expertise. And I just wanted us to have this segment because I need people to hear that, because often patients feel like they're at the mercy of the healthcare system, and whatever they picked, whatever card they drew, that's their card.
Yeah.
So in summation, Jessica, I think what we're saying is mass, unexpected, doctor caring, expected. Like,
Yes.
these are the two
Yeah.
orders in which you should
Correct.
put them. Okay, good.
Awesome.
Thank you for listening to this episode of Plastic Surgery Uncensored. It was, for me, very interesting that the unexpected was so different for the two women, and that you expected it to happen and the other did not. And yet, interestingly enough, you both are moving towards the same result, which is finding a doctor who cares and getting it resolved and behind you. Thank you again for listening to this episode of Plastic Surgery Uncensored with Dr. Roddy Raban, board certified plastic surgeon from Beverly Hills, and me, your co-host, Monique Marvez.